So this year, we are proud to present the lecture by Professor Dr. Ferenc Kuhn, a distinguished scholar who has made profound contributions to the field of ocular trauma. So I invite Professor Ferenc Kuhn to the stage for the endowment lecture.
Thank you very much. It's really an honor. I never expected anything like this. But I want to share with you a couple of thoughts that came to my mind when I was asked to give this talk. Having been in the field of ophthalmology since 1977, first, of course, as a beginner, then as a surgeon, but more recently, unfortunately, also as a patient. So this is the title that I gave to this talk, because I want to share with you a couple of general thoughts about the relationship between patient and doctor from both sides. So what do doctors do? You see a person who has some kind of a disease, whatever you call it, condition, or just an abnormality. So we try to heal, we try to treat, and the two are not exactly the same. Treatment means you focus on the condition, but as you heard, it's just as important to look at that person as a body. In other words, don't treat an organ, don't treat a disease, don't treat a tissue. And let me stop here for a second and tell you a personal story. About 25 years ago, a new treatment came along, treating a condition which before that was not treatable. It's called macular hole. And the community of ophthalmologists, of course, was very excited that we can treat this. And there were many articles about how to do the surgery, when to do the surgery, etc. And I remember I was sitting in the panel of a big international meeting, and the person leading the panel, standing here, turned to us and said, "So what is the limit or the indication when to do the surgery? How long do you wait?" And I was sitting as the last from this person in the panel. And all of my colleagues, 6, 7 of us, said a visual acuity number. So in other words, you start reading the chart and you get to 30%, 50%, whatever. And when they came to me, I said, it depends on what the patient wants. And everybody looked at me and says, "What do you mean?" I said, because when you come up with a number, the percentage number, first of all, there is no evidence that that's the correct number. But more importantly, we are not numbers. We are not the same. Each of us is an individual. For some people, even a 1% loss of vision means a lot and will not tolerate that. For somebody else, even 90% of loss is preferable to undergoing surgery. So our job as doctors is not to come up with these artificial numbers. Our job is to present the problem in a way, and I will come back to this, for that person to understand and make a decision for him or herself. So when you are a patient and you meet the doctor, how do you tell whether that's a good doctor or it's not a good doctor? Well, you can look at whether whatever treatment the doctor prescribed works or not. But is that a good way to do it or not? So let's look at Dr. A. You go to the doctor, you complain, the doctor makes a diagnosis the first time, gives you a pill, a drop, or something else, and instantly you're cured. Then there is Dr. B, who will try different things, and they more or less work. This is a very common experience. Then you go to Dr. C, who tries many things and nothing works. So, which of these three is the best doctor? Again, these are the options. If you look at this in a very superficial way, you would say it's Dr. A, because, hey, the problem has been solved. Easy. Dr. B, well, it was somewhat successful, but not really, and then, of course, Dr. C was completely unsuccessful. But what if I tell you that Dr. C tried everything she could, to treat a condition which is really not treatable, yet he put all his efforts into trying to improve it. It's very similar in the US. They always try to come up with rankings. So you have two hospitals. One of them is a small rural hospital. The other one is a very famous hospital in a very big city. And they have emergency rooms. They have intensive care units. And then you look at the death rate of these two places. And it turns out that the death rate of people in the very famous institution is much higher than the death rate in the rural hospital. So you would say, of course, that big, well-known place, it works better. But the problem is the patient population, the diseases, the conditions, the severity of the conditions is much worse in the famous hospital. So you cannot directly compare this. And for the same reason, even I have difficulty judging my own colleagues. If I go to an internist, a non-ophthalmologist, and based on what he does to me, I try to say whether he is good or not, I really won't be able to answer the question. Even among my own colleagues, who are not in the very same subspecialty that I work in, I will probably not be able to come to a truly scientific answer to the question of who is a better doctor. So this is not how most people will judge doctors. The judgment comes from something else, which is how do doctors communicate with patients? And very often, unfortunately, the answer is they don't. Instead of explaining things or explaining things properly, they simply tell the patient, this is what I'm going to do to you. So these are the questions that we all should ask when we talk to a doctor. Does the doctor explain to me in a way that I can understand? Will the doctor ask me questions so that I can answer them and so that he can get a better picture of it? And finally, can I say some things which he didn't ask? It's very important to have trust between doctor and patient. If you don't trust your doctor, you should move away and go somewhere else. Because without trust, the relationship cannot be ideal. And trust goes two ways. The doctor must trust the patient. What does that mean? Well, I do surgery on your eye, and after the surgery, there are certain things you are required to do. If you don't do that, either the treatment will not be as successful, or you can actually cause damage to your own eye. So we have to work together. I have to trust you that you will do what I'm asking you to do. But before I do that, I have to explain why I am asking you to do that. And then, of course, again, the patient, trust, who has to be convinced inside that the doctor wants the very best for me. So when we were in medical school, we were never taught in 6 years how to communicate with patients. And the reason why I practiced medicine very differently from my colleagues was, again, a personal story. I was very sick when I was in medical school after the 4th year, and it was a disease that they were looking for, which, if it is that disease, I would be dead in half a year. And I knew that. And yet, in the 2 weeks while I was at hospital, again, as a medical student, nobody, and I mean nobody, talked to me. Nobody told me what my condition might be. Nobody talked to me what procedures they will do on me. They were very painful back then, because a lot of diagnostics which are available today were not available back then. They didn't tell me what medications they were giving to me. And when I tried to ask, they did not give me answers. So I said to myself while I was in the hospital, if I make it out of this hospital and become a doctor, that's not what I will do. But because there was nobody to learn from, there was no literature to read how to do this, it took me several years to practice how to talk to patients. And I think I learned it. I can tell you long stories about how you judge whether you know how to talk to patients or not, but I don't have time for that. But I will tell you an example. So what you see on these 2 images, on the left-hand side, you see the back of the eye. This is the tissue with which we see. It's called the retina. That's the normal image that you see. On the right-hand side, you see some yellowish tissue covering the retina. That's a scar tissue, and you can do surgery for that. You can take very fine instruments and remove that scar tissue, and if you do it early enough, vision will go back to normal. So I had a patient in Germany when I was working there who came to me with that condition on the right-hand side. And I explained to him that this is a condition that can be treated. I explained how the treatment goes, what the percentages of success are, what the risks are, etc. And I was working there as a substitute surgeon for a friend of mine. Whenever he went on a vacation, I was replacing him. So I said, would you like me to do the surgery or wait until my colleague comes back? And he said, I want you to do the surgery. I said, okay. So I did the surgery, which went fine. And then I left. And I came back a few months later, and this patient showed up again. Now he had the same condition in the other eye. But I found out during our conversation that the eye that I operated on had a complication. It's a 1% chance for that complication, which did happen. He went to my colleague who operated, fixed the complication that I caused, and the patient was fine. Now he has the other eye with the same problem. So I saw him and I said, okay, unfortunately, you developed the same problem in your other eye. So my colleague will come back 2 weeks and then he will do the surgery. And the patient said, no, I want you to do the surgery. And I said, wait a minute, I caused the complication in your other eye. My colleague is an excellent surgeon. He fixed not only your complication, but he can fix this problem too. He said, no, I want you to do it. So this gave me a lot of thought. Why would somebody want me, who caused the complication, to do the other eye surgery? And the only answer I can give is because I was able, he spoke English, because my German is very poor. So I was able to communicate in a way that he had trust, despite what happened to the other eye. So for us doctors, again, to be able to convey not just what's wrong with the organ, but a lot more is something that should be taught in medical school and should be practiced in everyday life. So when you talk to the patient, and officially this procedure is called counseling, you try to describe a lot of things. But this process is a very complex one. You have to have empathy. In other words, you have to be able to put yourself in that patient's position as much as possible. And I will also tell you, it is not possible to do that 100%. Any of you doctors who think that when I ask you, so if you have this or that condition, what would you do yourself? And you give me an answer, I will say, that's what you say now that you don't have the condition. When you have the condition, your mindset will completely change. So when I say empathy, it means putting yourself in the other person's situation as much as possible. And then you describe a lot of things about the condition. I will briefly mention that. But also you have to pay attention to your meta-communication, your facial expression. What do you do with your hands? And something else which is very obvious. So you talk to the doctor about your problem, and the doctor does this. Do you understand that the doctor looks at his watch? The answer is yes, you do, because we are, constricted by time. Like, I don't finish in 5 minutes, and then we have to leave. But you have to do it in a way that the patient will not see it. Because if the patient sees it, obviously the conclusion, consciously or subconsciously, will be, okay, so he's not interested in what I'm telling him. He wants to go somewhere else. And then what you tell the patient. So you have to describe the normal, just as I showed you on those 2 color images, and you have to explain the pathology, the disease. And you have to try to give numbers to the patient, saying, for example, there is a roughly 80% chance of me being able to remove that scar tissue, and there is a 1% chance of that procedure leading to a complication post-operatively, and you describe that. But counseling is not a one-way street. It's not that you sit there and I am telling you things and you try to absorb it. That's not how it works. When I talk to you, my job is not only to convey what's in my brain about that condition. It is also, I have to read your face to see whether you understand what I'm saying or not. And you have to change how you describe the problem based on the person's individual traits, how intelligent, how educated that person is. I remember I was trying to describe things to people who lived in the mountains of Montenegro in Europe, where they live on a mountain in a very wild environment, both in terms of nature and human nature. They will look at you like this, and you really have to tailor what you're telling them accordingly. And you talk very differently to a colleague who knows all the words that you have to explain to somebody who's not in the profession. So based on what that person does will change how you talk to that person. And then we come to a very important question. Who makes the final decision? Traditionally, the doctor does. In other words, I will tell you, this is your condition, this is how you treat that condition, and this is what I'm going to do. This is very typical. This is how I was brought up. The patient came in and the doctor said, okay, I'm going to do surgery on you tomorrow. That's it. So there was a very famous case more than 100 years ago in the US, where I don't want to go into the details, but this is what the judge said. The essence of what he said is this: you own, we are talking about the eye, you, the person who came to me with the problem, you own the eyeball. I don't own the eyeball. You own the eyeball. Therefore, my job is not to tell you what will happen to your eyeball. My job as a doctor is to explain things again in a way that you understand, so you can make the decision what options you choose of those that I present to you. And this is the philosophy I have been following all my life. I explain and let the patient make the decision. Now, sometimes, and I will give you an example, sometimes I really disagree with that option. Example, you have a surgery or an injury after which there is a purulent infection inside your eye. And we know that if you don't treat that, you lose vision very rapidly, forever, and you have a good chance of eventually losing the eyeball as well. But still, if the patient says, I do not want treatment, the patient has the right to say that. But I don't want that to happen. So if I tell the patient, you have basically two options: to do nothing, you lose your eye, or we go to surgery now, and I will try to save as much as I can. And if the patient says, I don't want surgery, I said, listen, let me explain again. We have hours or days to intervene. If you don't have surgery, you have zero chance of vision and a very good chance of losing the eyeball too. Are you sure that's what you want? And if you do that, nobody in my practice ever selected no surgery. But still, the right to say that is not mine, it's the patient's. Vision is very important. We own that, know that. Almost all the information from the outside world comes to us through our eyes. That's what you lose if you go blind. So, if you have an injury and you decide to wait, and I have seen very intelligent, very educated people not going to the doctor with that problem because of, and here is a list of possible explanations why you don't go to see the doctor. That's a terrible mistake. So as a general public, the most important message is, if something happens, don't wait. The more you wait, the less chance of you coming out well from that situation. There is nothing positive. Just like when you are on the tracks and this train is coming, don't wait. Move away. Go and see the doctor with the condition. So our job as eye professionals is to restore vision, and the best example of successful surgery is a cataract. The most successful surgery on the human body. And there are many, many other diseases where we have very good methods of treatment. And then injuries where it's a lot more complex, and unlike the first category before the previous slide, this one requires a more special treatment, and a lot fewer people do trauma, and therefore you better go to a place where a lot of injuries are treated. Cataract is a fairly simple, very fast, very effective procedure with a very low complication rate, and once you have that cataract removed and an intraocular lens that you see on the finger on the right is implanted, almost all patients will have excellent vision after. But this is a very important thing to remember and mention, because one of the things that all those who are in medicine, but especially in the field of injuries, should understand that you cannot just follow what other people did. You have to use your brain, you have to think differently out of the box. So cataract surgery has been around for hundreds of years. It was done very differently. But what's common about it is that that cloudy piece of lens, which is the cataract, was taken out of the way. Again, different methods. But that little organ there, tissue, not only has a function of letting light in, it lets you concentrate on different distances. So if a young person looks at this room, he can see very clearly what is on the laptop computer or in a book and into the distance as well. If you take out the lens, that's gone. You see nothing without glasses. So after cataract surgery, we used to prescribe a very thick lens for the patient, which gave you relatively good vision, but it was very thick, heavy, inconvenient. So this person on the right-hand side, or actually both of them, the young version and the old version, was one of those surgeons who was taking out these cataracts. You take out that lens and surgery is done. And one day he had a medical student in the operating room, and the medical student looked at Sir Harold Ridley, the surgeon, and said, "Why don't you put something inside the eye to make up for that loss?" And that led us to today with the intraocular lens. But it had to be somebody outside the profession, because that person's mind was not on a track where you simply follow what everybody before you did. So what I'm telling my colleagues, young colleagues, is to not follow, but come up with different ideas. So I just want to show you a brief video, and then I'll stop because of the time. So this is how cataract surgery is done today. It used to be a long, difficult operation with possible complications before and after. And, I'm sorry, during and after. So what you see here is This is the actual lens, which is taken out by an ultrasound and then aspiration, and then this intraocular lens is implanted. In a very experienced surgeon's hand, this surgery now takes 5 minutes. It used to take half an hour and a lot of potential complications during and after the surgery. So technology has improved tremendously in the last 30 years or so, and that means that a lot of the patients that I saw when I was young who went blind will have excellent vision today. But for that, as I said, you have to go and see your ophthalmologist. If you don't, and I remember patients who were blinded in one eye with one disease and they still did not go to the doctor, and then they had the same disease destroying the other eye and they still wouldn't go to the doctor until somebody grabbed them and said, come on, let's go. So, in conclusion, the horrible way of practicing medicine is the doctor is up here and the patient is down there. That's not a doctor who does that. You have to be partners. You have to work together. You have the same goal, making the condition better, and you have to work together throughout the whole process, which can take many years in certain conditions, or forever, for example, in diabetes, to work together for the same goal. And do we have the sound on? Let me finish with, on the funny side, it's not only true for doctors, but in life in general. If you can't fix the problem, at least have an explanation about it.
Réagir, j'étais embarqué dans un camion de livraison et voilà comment j'ai atterri ici.
Ah, c'est incroyable, hein. Hein, t'entends ça, chérie?
Oui, c'est fou.
So finally, I want to say thank you for an exceptional person, an exceptional ophthalmologist who is also a great humanitarian, as you heard. And that was just part of what he has accomplished. There is nobody else like him in the world. I can testify to that because I have been to almost 70 countries as an ophthalmologist. And also my wife, who's sitting there, because he put up with me for all these decades when I was not at home. So without her, without him, I would not have been where and what I am today. Thank you very much.